talking about descriptive design, and yet the kind of variables is presenting are complex. So that alone begins to bring issues. One would argue that the relationship between parents, parendo, teacher, and anxiety on academic achievement, that parendo can stand as a study on its own. You can have variables from there that can stand as objectives. Parents do what? They pay fees, they probably attend meetings at school, which means they probably support the learners in terms of doing their homework and so on. So those can stand as components of the parental component on academic achievement. If you go to teachers, that can be a study on its own as well. So there are many variables that you could look at the effect of teachers on academic achievement: class attendance, syllabus coverage, marking of homeworks, how many exams have been given, mentorship, and many other things that could stand out as objectives under the teachers alone. Anxiety is another study. We have economic anxiety, we have social anxiety, we have psychological anxiety, we have, someone can even argue about physical anxiety. You are unable to walk because of an injury or something like that. So there are several things that can still stem from just that topic of anxiety as objective. So you can measure economic anxiety, you can measure, there is even academic anxiety. You don't know whether you will pass exams. So how do we measure those things? So looking at that title, I see three distinct titles that can be studied and the effect of those on. So it's like it is too broad, in my opinion, but that's fine. That's my take. And in social science research, we could actually have different standpoints. Usually, as the document goes up, we will allow judgment to be passed up there, examiners and DPS and so on. So I think this is a learning opportunity, and thank you very much, Professor Odera, for raising that up, and contributions from Dr. Aura. Thank you so much. Now that we didn't have Professor Odera, your hand is still up.
No, that's the earlier one. I don't know how to remove it.
Okay. Then you need to pull it. Then you need to put it down.
Just tap on the hand. Tap on the hand.
Tap on the hand, and it will go. Thank you. Thank you.
Amanda.
Yes, Amanda. Thank you. Allow us then, colleagues, to move on to our next candidate. On the schedule, our next candidate is Sylvia Kanaiza. I think I've seen Sylvia in the house. Dr. Edward Okaya and Dr. Manson Sichari are the supervisors, and I can see Dr. Joel Ogutu has been in the house for quite some time, is the reviewer. So I want to invite, I don't know, I haven't seen Dr. Okaya, probably Dr. Manson Sichari, kindly introduce to us Sylvia and bring her to us. Sylvia, you have 15 minutes from the time your supervisor introduces you, and tell us what Sylvia does. She could be some big person in the Ministry of Education or Q or wherever. So beyond just telling us that, tell us what they do for a living. That would help us. One time someone lost a job in Kenya for not knowing people. So we don't want to say something that can offend the powers. All right, Dr. Sichari.
Okay, thank you, Chair. Sylvia Kanaisha is one of our students, and we are supervising her, me and Dr. Kaya. She's a teacher in Kakamega County. Sylvia is one of she's quite a good student who always takes advice and hence allowing supervisors to help her as much as possible. I'm sure she's going to take any advice that should be given here by colleagues and the critical reader seriously, and therefore improve on her proposal in readiness for the collection of the data. Otherwise, I welcome Sylvia to present her proposal confidently. Karibu Kanaisa.
Thank you very much, Dr. Terry, and thank you, Chair.
Yeah, share your slides, Sylvia. The time is 9:56. You stop 15 minutes after now. Actually, 9:57 now.
Okay, thank you, Chair. Kanaisa Sylvia, as we've been told, my supervisors are Dr. Kaya Kasakala and Dr. Sichari Manson. My title is Efficacy of Applied Behavioral Therapy in Teaching Social Communication Skills to Learners with Autistic Spectrum Disorders in Kakamega County. Being the trailblazer student in autism, allow me to delve into the title and say something about the title. So to make us understand my study, I begin with the applied behavioral therapy. Applied behavioral therapy is an evidence-based therapeutic approach that focuses on systematically applying behavior principles to improve social significant behavior. And this happens in three categories. You analyze the behavior, you identify how the environment affects the behavior, then you start implementing an intervention. And what is social communication? Social communication is the exchange of information, feelings, and meaning between two people through verbal and non-verbal methods within a social context. And lastly, who are these learners with ASD? Learners with ASD are learners who have a complex neurodevelopmental disorder characterized by challenges in social communication and repetitive behavior. And the main challenge they face is they are unable to understand and express emotions. They are unable to maintain and reciprocate social relationships. And lastly, they are unable to, or they find it very difficult to interpret non-verbal cues. Another background of the study, as I have told you, ASD is a neurodevelopmental condition that is characterized by challenges in social communication and repetitive behavior. According to DSM-5, the ASD has been identified by APA in 2013 to reflect a scientific consensus that 4 previously separated disorders are actually one condition with different levels of severity. These 4 used to be Kenner syndrome, Asperger's syndrome, pervasive developmental disorder, not otherwise specified. But now we look at it under the umbrella of ASD. The major difficulties that these learners have is the social interaction impairment, communication impairment, and restricted repetitive behavior, like wringing of the hand or rocking. That is one of the repetitive behaviors that these learners are likely to be affected with. Social communication encompasses a number of skills. This could be verbal expression, comprehension of language, use of gestures, facial expression, and understanding social cues. And as I continue, applied behavioral therapy is commonly used in treatment of conditions including autism, disorder, developmental disabilities, and challenges. At that point, maybe we can ask ourselves, what is a therapy? And a therapy is a kind of medication that is given, or a kind of treatment that aims to help resolve mental issues. And ABA is characterized by its emphasis on objective measurement, data-driven decision-making, and systematically application of behavior strategies. The statement of the problem: despite the increasing recognition of the importance of applied behavioral therapy in enhancing social communication skills in learners with ASD, there is a notable gap concerning its application and efficacy in Kakamega County in Kenya. While ABT has shown promise in Western contexts, its appropriateness and effectiveness in the Kenyan cultural and educational setting requires further investigation. Moreover, previous research on ABT in East Africa, including Kenya, is limited, necessitating a comprehensive study to explore its potential impact on learners with ASD in Kakamega County. An intervention has to be taken to ensure the ASD learners live a holistic life and achieve what they can achieve in life. The purpose of the study seeks to investigate efficacy of applied behavioral therapy in teaching social communication skills to learners with autistic spectrum disorder in Kakamega County. Research objectives: Objective 1, to determine the influence of ABT on acquisition of non-verbal and turn-taking skills in learners with autism in Kakamega County. 2, to determine the influence of parental involvement in implementation of ABT on acquisition of communication skills among learners with ASD in Kakamega County. And lastly, to examine the relationship between teacher demographic factors and acquisition of social communication skills among learners with ASD within Kakamega County. Next, we have the research questions. Research question 1, what is the influence of applied behavioral therapy in teaching acquisition of non-verbal and turn-taking skills in learners with autism within Kakamega County? Number 2, what is the influence of parental involvement in the implementation of ABT on acquisition of communication skills among learners with ASD in Kakamega County? And lastly, we have what is the relationship between the demographic factor and the acquisition of social communication skills among learners with ASD in Kakamega County? The study has one limitation, and the limitation of the study is the floor and ceiling effect. And the floor and ceiling effect is whereby the respondents may deflect or reflect information that they are given when assigned a questionnaire. And how is the researcher going to deal with this? To mitigate this limitation and provide robust and valuable insights, the researcher will consolidate the data from the questionnaire with other data collected using focus group discussion, observation, and interview sharing. What is the significance of the study? The significance of the study is divided in a number of ways. This study will be significant to the ASD learners where they have improved social communication skills, increased inclusion. Once they are able to communicate, inclusion can take place, and they are taken from the special units to the mainstream. And there will also be an enhanced quality of life for the ASD learners. And how is this study significant to the parents and caregivers? Number 1, they gain insights on the evidence-based intervention to support the learners with autism. And this study will also be significant to the therapists, now that we're using our therapy, and also to the educators. They will gain a deeper understanding of ABT, applicability, and modification to suit the Kenyan learners. And this study is also important to the policy makers, whereby decision making concerning the ASD learners, resource allocation, and lastly, the policy development to enhance support for the ASD learners. The theoretical framework, two theories will be used. One will be the autistic theory, and this autistic theory is the social motivation theory of autism. It's also known as lack of interest hypothesis. It suggests that individuals with autism spectrum disorder are not inherently uninterested in social interaction, but that their reduced social motivation is due to their difficulty in understanding and perceiving social cues, emotions, and intentions. Maybe to demystify this, I'll just give a slight example. A 5-year-old boy, that could be my son, he takes pleasure in tying his shoelaces. Why? Because he knows there's a reward for that. And after he has tied his shoelaces, he may be hugged or congratulated for achieving that. But an ASD learner does not understand the social key, but an ASD learner does not see any motivation towards being hugged or being congratulated for having accomplished a task because of the altered reward system in the ASD learners. People with ASD struggle to find social interactions rewarding or enjoyable due to difficulties in understanding and processing social information, leading to a lack of motivation to initiate or engage in social interaction. This theory suggests that social difficulties in individuals with autism arise from a more fundamental difficulty in processing and understanding social information rather than lack of social skills. It's not that the ASD learners do not want to learn. It's only that their reward system is altered. Then we move to the conceptual framework. The conceptual framework, we have different variables. We have the independent variable, that is the applied behavioral therapy. The dependent variables, we have the non-verbal communication and turn-taking skills. We have parental involvement, and we also have teacher demographic factors. The intervening variables, we have severity of the level of the ASD, and we also have challenges in the implementation of applied behavioral therapy. The research design for this study will be a mixed method approach, whereby the quantitative and qualitative, there will be an integration between the quantitative and qualitative data collection and analysis techniques. The quantitative component employs standardized assessment tools to measure pre and post intervention social communication skills, while the qualitative component involves an in-depth interviews and focus group discussions to gather nuanced insights from the caregivers, parents, and teachers regarding the impact of ABT on learners' communication. Then we have the population of this study. The target population of this study will include the caregivers of these learners. We understand that some of the autistic learners are taken to schools or centers where they only deal with the caregivers and their parents take them once a while. So parents will also be among the target population. We have teachers dealing with ASD learners in Kakamega County. So those will form the bigger part of the sample that will be picked. A sample of 600 participants will be recruited, representing a diverse range of perspectives from those directly involved in the learner's social communication.
And frankly, you know what? Our Constitution is much more important than
There will also be an inclusion of multiple stakeholders to ensure comprehensive exploration of the research topic and provide a holistic understanding of interventions efficacy. The sample size and sampling technique. The sample size for the study will comprise of 600 participants, including the caregivers, parents, and teachers of learners with ASD in Kakamega County. The sample size is determined based on practical considerations, resources, and the need to obtain rich and diverse perspectives from multiple stakeholders involved in the learner's social communication development. Random sampling technique will be utilized to ensure equal and unbiased representation of participants. List of the learners with ASD from special education schools and support centers will be obtained. From this list, a random selection of caregivers, parents, and teachers will be approached to participate in the study. Purposive sampling will be used in the special units which are inclusive. Data collection and analytical methods. Quantitative data will be collected using standardized assessment tools to measure the learner's social communication skills before and after ABT intervention. Descriptive statistics and inferential analysis such as t-tests and correlations will be applied to examine the effectiveness of ABT. Qualitative data will be collected through semi-structured interviews and focus group discussions with caregivers, parents, and teachers. Thematic analysis will be employed to identify key themes and patterns related to the perspectives and experiences of stakeholders. Another instruments will be used to collect data. They include interview schedules, questionnaires, focus group discussion, and a pilot study will also be carried out. This pilot study will be carried out in Mumia's autistic school, which is within Mumia's town. The validity of the study will be established by presenting the instruments to experts in the School of Education, Psychology, and my supervisors who will be able to advise on the validity of the instrument and adjust as per the comments. The reliability of the instrument will be established through the test method, while the validity, through test and retest method, while validity of the instrument, data analysis will be both descriptive and inferential statistics. Quantitative data will be presented using tables, charts, and graphs, and the qualitative data will be analyzed through content analysis. And lastly, we'll have the ethical considerations. The researcher will adhere to a number of ethical principles, bearing in mind that we do not want to expose or we do not want to psychologically harm these learners with ASD. So the following are some of the ethical considerations. Written permission from the county education office will be sought before the researcher begins, goes to the field. Voluntary and confidential participation. In case one of the people that is not willing to participate, they will not be forced to participate. And if they want to participate and they want the information that they are giving to be confidential, it will be treated as such. Protection from physical and psychological harm for both the ASD learners and the caregivers and the parents. And lastly, there will be voluntary withdrawal from the study. In case the study causes some kind of discomfort, any among the people taking the study will be allowed to voluntarily withdraw from the study. Thank you very much. That is the end.
Thank you, Sylvia. You went overboard by 3 minutes. Allow me to bring in our reviewer. Our reviewer is Dr. Joy Ojuku from the Department of Educational Psychology. Those who are not speaking, kindly mute. Dr. Joel Ogutu Karibu, you have 10 minutes to do your
Thank you, Chair. Thank you, Chair. Good morning, Sylvia Kanaiza.
Morning, Dr.
Yeah, I was given an opportunity to go through your work, and I think I will try to utilize the time given to me so that we can make progress. The title, as it reads, Efficacy of Applied Behavioral Therapy in Teaching Social Communication Skills to Learners with Autism Spectrum Disorder, Kakamega. I find the topic is appropriate. However, when we go to the objectives are not aligned to the topic. For example, in your topic title, you have used a very important term here, efficacy of applied behavioral therapy. And efficacy could also mean ability or power or capability. But now your objectives are talking about influence. I really don't know whether influence could also mean efficacy. Maybe you'll respond to that. In your background of the study, I expected to see more of the behavioral therapy techniques being explained here, and considering that you are dealing with the autism child, perhaps social skill strategy, which falls under behavioral therapy, should have been explained. This includes either modeling behavior rehearsal, and shaping. I think those are very key on the skills that we'll use to bring about this child who has autism to begin aligning himself to social communication skills while teaching. That one has not come out properly. In the same area, the steps in applying behavioral therapy is very, very key. In the background, that is also lacking. We have the APC steps, the A for antecedent, or what the child has before the target behavior was initiated. And the B is how this behavior of a person is responding. Is he responding or is not responding? And C stands for the consequence of these interventions. Is there any outcome from the behavior that is being targeted? Again, this should have been explained so that whoever is reading your work begins to see the marriage between the behavioral therapy and the communication skills. So, problem of the study, problem statement, again, is not clearly focused. It does not bring out the motivation behind this study. There are no figures, there are no clear facts why there is need to focus on autism study in Kakamega or not even elsewhere. What is really missing? What is the issue? What is the main concern that makes us go that direction? I think I've mentioned something about the objectives. I don't need to repeat. I've said that they are not well aligned to the topic. Your limitations, I have not seen much out of it. Limitations should be focusing on methodological issues in your study that you are likely to encounter, that you will tend to derail the study. And then you bring in the mitigation that can be able to help you this. What you talked about here is about issues of what? The flow and the ceiling effect, which is again not well explained. Now, in your theoretical, in your conceptual framework, if it was reading from the topic, then you would see more of these interventions, the ABET techniques coming out in the conceptual framework, and in this case, it has not been done so. You have clearly indicated the intervening variables, but then there is very little explanation on how these intervening variables will be controlled in your study so that you really get what you're looking for. Chapter 2, I think it's prudent that you should have focused your main themes as derived from the objectives, so you don't have too much of the work that is not going to help you in discussing your thesis in chapter 4 later on. You should differentiate between writing a proposal and making lecture notes. So you will bring in what is very, very key. And that has not come out very, very clearly. And you should know that you are reviewing the works that have been done by other people. And the work you are reviewing is empirical studies that have been done with a view of focusing on the methodology, the frameworks that have been used, the findings and conclusions, and then identifying the gaps that the current study is going to zero on. This has not come out very, very strongly in your literature review. So you need to do something about that. Coming to chapter 3, your research design, you have clearly said it is going to be mixed research design, where you talked of integrating blah, 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 blah. Now, there are so many research designs. Why mixed research design? This is not come out clear. And how relevant is it to the objectives and to the title of the study? Are they talking to one another? I think at your level here, we don't require research philosophy, unless I don't think if it's necessary here. Population. The target population is also not very clear. You all mentioned that caregivers, teachers, blah, blah. But they are not telling us how many are these you are targeting. Instead, you have talked of a sample of 600. I don't know whether this a sample is not the same as target population. So you need to differentiate between a sample population. The word is sample. That means you are picking from the main population. So from the main population, or the universe, how many are they? How many are these people? And for each, you should tell us why targeting the caregivers, why targeting the teachers, why targeting the education officers we have talked about, or the stakeholders. Sample size and sample techniques. I think the arrangement should come first of all sample techniques, then sample size. If the target population is very clear, then you will be able to sample from that. What is lacking in your sample size is the formula for sample determination. It is not very clear. How did you determine your sample size? Sampling techniques, they are also mentioned here, but it's not very clear. Why zeroing down even, for example, random sampling? Why? And how are you going to do it in this study? I'm just giving that as an example. Pilot study. In your presentation, you're talking of mummias, but me, I'm reading your work. There's no mention of mummias anywhere in the work that you gave. So please, again, you need to rework on your pilot study And when it comes to reliability and validity and a pilot study, it's good to clearly tell the reader what type of reliability you are going to apply, why you are going to apply it, because you have so many types of reliability, and how it's going to be applied in this study. The same should apply also to validity. This did not come out very, very strongly. And finally, when I went down in the appendices, I expected to see the tools for collecting data as we have mentioned them here: the questionnaire, the interview, focus group discussion, field notes. But they are now missing. They are not there. And I want to believe that your presentation of this work is at the tail end of presentation. We are not going to have another presentation of your hypothesis, your proposal after this, because we are at school. And the school is now to determine whether you go to the field or not. Are you going to go to the field without the tools? And how did this work pass the department to reach the school without the tools that the student will use to determine, to collect data? Does it mean that you'll be rescheduled at the school again so that you can validate your tools? Now, with those, finally, is it possible for you to determine the progression of an autism child in terms of getting appreciation on communication skills? Just
Doctor?
Hello? Hello?
Yes.
Yeah, I was just giving a statement here that I don't know how practical it will be for this study be a mixed study research rather than more or less like a quasi experimental study, so that we begin to see the progression of this autism child when this therapy is being conducted. Can this, because when you're using a questionnaire, maybe you'll just collect data in a day. Will that provide enough information on how this child is progressing as the application of behavioral therapy is being applied to him or her? So, with those very many remarks, those are some of the observations I've made, but the more detailed work will be presented in the right time. Thank you.
Thank you very much, Dr. Gutu, for that very comprehensive review of Sylvia's work. Before I give Sylvia time to respond, I would like to request us, we are about 45 now, and Josephine, who is taking our minutes, may not know who exactly we are, what our program is, whether PhD or master's, area of specialization, which department. Kindly go to the messages and type in those details. We've pinned that message so that when she's drawing up her list of attendance, at least she doesn't mingle up the issues. So thank you very much. Sylvia, kindly respond to some of the salient issues that Dr. Ogutu has raised.
Thank you very much. Maybe to respond to some of them, there's like the objectives versus the title. I would request to look at them with my supervisors and shape them up. And the information, most of the information, I think I put the information, I did not write it in the background, but it's there in chapter 2, for example. The percentage, the figures, currently in Kakamega, we have 32.7% of autistic cases. That is if the 100% refers to learners with special needs. And also we have the how to measure if the autistic learners would have gained the social communication skills. And the idea was I would go there early enough, maybe 2 months in advance, and take time with the teachers and caregivers. First of all, give the first questionnaire and take time with the teachers and caregivers. So I would go through the therapy, then come back. Alternatively, checking on the progress of the students so that at the end of the 2 months to see if there is any remarkable improvement, especially on the marks and even interpretation of non-verbal cues, just the simple ones like greetings and requests. About Mumias. Mumias is in Kakamega County, and I thought of it because it is exclusively an autistic school. So all the learners who are within Mumias school, all of them are autistic learners, and also the school has embraced a number of therapies, including the water therapy. That's why the interest was there for me to carry out the study there in Mumias. That is for the pilot study. For the reliability and validity, I'll have a second look at it and rectify where possible. For the limitation and other limitation apart from the flow and ceiling effect, and I'll also go ahead and identify the gaps. I believe I've done partly, but I'll do a comprehensive identification of the gaps in chapter 2, and of course do other advice. I believe the remaining ones I can have a sit down with my supervisors and they advise me on what to do going forward.
Sylvia, why don't you have instruments? How did you come up to school level without instruments in your proposal? There are no questionnaires and other tools. Why? Why is that the case?
The problem is from my end. I'm sorry for that. Critical reader is not the real.
Sylvia is breaking. Okay, we'll give Dr. Ogutu any follow-ups with the candidate.
Yeah, the follow-up with the candidate is that some of the information he has presented is not actually in the document. So it is good that he condensed our document properly, not bring in some information that are not in what you have been given to read. Just like I was pointing out, under pilot study, he just mentioned pilot study, but he did not tell us how it's going to be done and where. But in her presentation, he was committing and said what it's going to be done. You know, this one is like in a court of law. You are bringing in evidence after the statement has been taken from you. It may not be accepted. This was knocked out as a mere one time. So let her do her things properly. Then the other thing about her document, particularly in chapter 3, it looks like mixed up some things. Some sections have been mixed up. Like I can see her presenting something on data collection and analytical methods under 3.7. Then in 3.8 is now giving us, it's giving data analysis plan. And then pilot study is coming down there. It's the second last to ethical considerations. It is taking the position of data analysis. That also means that Kanisa, you need to do a lot of work on providing the right format of your work. So there is a clear flow. Unless there is anything special with the special needs education, so that you present yours differently. Those are some of the remarks I can give to the candidate.
Thank you, Dr. Ogutu. Sylvia, that's quite a platform.
But the issue of Nini has not clarified. Does it mean that you will come back here so that we give her an okay to proceed? Because now, how will we walk out there without the tools? It's like somebody who is going to the chamber without carrying the seeds and the jembe, so doing the work. These are the most important things that is going to do.
Thank you, Dr. Ogutu, for that review of the work. I was saying that, Sylvia, you have a plate full of comments to consider for making your proposal strong. Your slides are very, very crowded, extremely crowded. I think Dr. Ogutu, kindly mute. Thank you. In the next posting, I think I'll put some guidelines, some documents to guide us in doing our slides. Those that I've seen so far are very crowded. Thank you very much. Let me open it up to members of faculty in the boardroom and our students. Any member of faculty with an input into Sylvia's work. Put up your hand. Yes, Professor Odera. Professor Odera, yes, you have the floor. Kindly unmute, probably. Okay, we can't hear from Prof. Prof, kindly unmute and then proceed. Sorry, his hand is up, but we can't hear from him. So we will. Yes.
I'm sorry, I had a network hitch, but I'm back.
Okay, thank you. As we wait for Professor Odera, any student with an input or a question? Yes, Masakala Alex.
Thank you, Daktari. Also being a student, I'm just maybe concerned about her objective number 3. Does it not qualify to be a hypothesis rather than a question? Maybe just a concern, not even a question.
Okay, Sylvia, you look at your objectives as well as your hypothesis if you have those or research questions. Professor Odera has not unmuted, and so we probably can't hear from him, unfortunately. Okay. All right. Thank you very much, colleagues. When professor gets an opportunity, he can input into Sylvia's work even as we progress. Allow me therefore to move to our fourth candidate. Our fourth candidate is to present today, but listed as number 3 on the program is Wamanga Amos.